Well, if you feel like I felt this morning, you'll know that hay fever season has pretty much kicked in. As temperatures rise, the tree pollen starts to fly. That can mean watery eyes and a runny nose. Health specialist Leah Sarich is here now with what you can do to get some relief.
Yes.
Everyone who's watching me, I was like,
oh, and it totally makes sense that it's happening right now. And in fact, I spoke with allergist Dr. Joel Doctor, and he says, do it now. Go see your doctor if you need prescription medications. Go see your pharmacist if you're dealing with over-the-counter medications, and do it today. He said,
okay,
today.
get on it. Get on it
today. The reason being is that if you can get your medication going before your symptoms get really, really bad, they're going to be more effective.
Okay.
So that's the #1 thing to think of. And if you're wondering, do I have a lingering cold here, you know, from the cold weather, or do I actually have my hay fever already? There's a way to really tell the difference, and Dr. Joel Doctor outlines exactly what that is.
Hay fever symptoms are very similar to symptoms of a cold, with one really key distinction, and that's itch. Hay fever causes very intense itching of the eyes, of the nose, and often the itching extends into the ears and the palate as well. And then in addition to itch, also the more typical symptoms is sneezing, nasal congestion, profuse watery nasal discharge. The sneezing can be debilitating. I mean, there could be sneezing 5, 10, 20 times in a row. Sometimes people think, well, hay fever is just a mild problem with the eyes and nose. It's not that big a deal. But in fact, in terms of quality of life, it can have a major impairment.
Absolutely, a huge impairment.
my husband suffers, and I've never seen somebody, I mean, he's had to take days off work because
Absolutely, you can be in total distress. You know, work can be affected, school can be affected for little kids that are suffering, even driving and things like that can be affected. So the good news is that there are many treatment options out there, which is great for every kind of allergy sufferer, whether it's just mild or very, very severe. It's just a question of determining exactly what's right for you.
For mild hay fever symptoms, just a straight antihistamine should do a pretty good job. If congestion is really quite troublesome, then sometimes a decongestant version of antihistamine could be used as well. And that tends to work for relatively mild hay fever. If hay fever is more severe, then it's necessary to use prescription products. And there are some excellent prescription products, nasal cortisone sprays, allergy eye drops. And then if hay fever gets considerably more severe, there's other options, including desensitization.
So I wanted to talk a little bit about desensitization. Yeah. So there's two options when it comes to that now in Canada. There's something I want to talk about firstly, which is the sublingual tablet. This is relatively new in Canada. We talked about it for the first time last season. And basically it's a little pill that you put under your tongue, you do it daily, and it'll actually give you about a 30% reduction in symptoms. So that's not too bad. The other thing to do is the allergy shots. Now that is a big commitment because you're going to go to the doctor and you're going to get shots once a week for several months, and then you're going to get them, daily, and then you're going to get them weekly, and then you're going to get them for several months, and then you're going to do this for years.
Okay, so
however,
really suffer.
Exactly. Yeah. However, the good news is that you're going to get a 70% reduction in your symptoms, and that reduction is going to last for years and years and years. So if you can be committed to it, that's a really good option if you suffer from really extreme allergies. The other note to consider, if you're doing the over-the-counter antihistamine, and you need a decongestant, just keep that in mind that there are regular brands and then there are regular brands with decongestant in them. Now, only take the ones with the decongestant if you really need that symptom relief, because it does have side effects. So the decongestant can actually cause jitteriness and sleep disturbance. So you do not want to take that at nighttime. If you do need it, take it during the day only. That's Dr. Joel's.
I do not like that stuff.
Yeah, exactly. It has lots of side effects.
Before we let you go, Leah, you know, if you're pregnant, you can still be suffering from these symptoms.
Absolutely.
Do you need to stay away from all of this stuff?
Well, there are things you can do, but very quickly, the best thing to do is try to avoid the medications altogether by avoiding your allergy triggers. So if you look out the window and you know it's a hot, windy day, that's going to be a bad day. Stay inside. That'll help you reduce your symptoms. However, if you do really need that medication, there's a couple of options. Benadryl, it's been around for years and years and years, almost 100 years. That will be safe for you. Also, Reactine. It's a derivative of another drug that's been around for about 70 years. That'll be safe as well.
Okay, probably consult your doctor.
Absolutely, talk to your doctor for sure.
And more on your blog.
More on my blog, absolutely.
Health specialist Leah Sarich, thank you for
You're
this.
very welcome.
BreakfastTelevision.ca is the way to find her.